In Healthy Living this hour, do you wake up tired after a full night's sleep or sometimes suddenly wake up in the middle of the night? You could be suffering from a very serious condition called sleep apnea. Dr. Madan Kandula joins us this morning to talk about what exactly sleep apnea is and how it's treated. Thanks for being here.
Thank you for having me.
Basically, when you're having an episode of apnea, you stop breathing.
Correct. Yes, and that's what happens. There's two forms of it, central and obstructive. Central is not too common. Obstructive is very common, and it's basically like you're strangling, struggling to breathe and stopping breathing multiple times throughout the night.
And then the person, in most cases, will start breathing again on his or her own.
Correct. Usually it lasts for a few seconds, sometimes for a few minutes. Eventually people wake up to some extent. Most people don't realize they're waking up, but the end result of that is a unrestful night of sleep.
And there's a danger in it as well.
Yes, absolutely. Basically, just as if you could imagine, if somebody's coming in your bedroom and strangling you every night, throughout the night, it's hard on your heart, your lungs, on your body, and during the day, people are very unrestful and very tired, and a lot of times very irritable.
How is it diagnosed?
The gold standard as far as diagnosis is something called a sleep study, and what that involves is pretty simple. It's basically a study where you go in at night when you'd normally be sleeping. They hook you up to some monitors and check to see what happens when you sleep. If you're trying to breathe, if you're struggling to breathe, if you're snoring, and if you're stopping to breathe.
And do you necessarily have to be a snorer to have apnea?
No, although most people who have sleep apnea snore. Not all people who snore have sleep apnea, but snoring is a pretty, it's something that's very predictable as far as, again, people who have sleep apnea most oftentimes snore, and especially in children. Children who snore are at increased risk of having sleep apnea.
And also increased weight puts you at increased
Correct.
risk.
And it's actually, in adults, increased weight definitely puts you at increased risk. A lot of times children, because they're developing, if they're struggling to breathe at night and they're not getting restful sleep, a lot of times children will actually be underweight, but adults who are overweight are at a much higher risk of sleep apnea.
And let's talk about the treatments, because there are a couple for it.
Sure. The treatments are, there are two main sorts of treatments. One is a machine called a CPAP, which is, it's a short name, where basically it's sort of like a vacuum cleaner that works in reverse. So instead of sucking air in, it pushes air out, and something that's hooked onto the patient's nose while they're sleeping. And it basically helps to keep the airway open while they're sleeping. That's very effective for sleep apnea.
And then medication?
Medication actually has not been too effective.
Okay.
Yeah, surgery actually is another alternative that works for people who have mild to moderate sleep apnea. And also for children, the most common reason for children to have sleep apnea is enlarged tonsils and adenoids. So removing tonsils and adenoids in children is very effective for them.
Dr. Kandula, thank you so much for being here.
Thank you for having me.
If you think that you may suffer from sleep apnea, check it out with your doctor. It's not something to ignore. It's 8:23 and still ahead. This story of a dog who's stealing the show for a minor league team. Plus, these so-called lucky viewers are here to show off their moves this morning to win tickets to Great America. Hit it!